Hello, my name is Ashley Harris. I work as a CNA in a telemetry unit. Today I'd like to talk about 5 different ethical issues surrounding communication in healthcare research, with a focus on how we as Christian professionals can stay grounded in both science and faith. I hope this video will help all of us reflect on our responsibilities in patient care and research communication. Number 1, principles of scientific communication. Scientific communication must be clear, accurate, honest, and respectful. These principles ensure that information shared in research or clinical practices leads to safe and ethical patient outcomes. Whether documenting patient vitals or contributing to clinical studies, we must avoid exaggeration, bias, or misinformation. This includes how we communicate research findings and patient information. Number 2, ethical implications in human research for allied professionals. As a CNA in telemetry, we may not lead research, but we often assist or interact with research teams and patients involved in studies. We must protect human dignity, maintain confidentiality, and ensure informed consent is respected. Patients should never feel coerced into research participation. Ethical principles like autonomy and justice guides us. Number 3, ethical issues around communication in research. Miscommunication in research can harm patients and mislead providers. In telemetry, inaccurate documentation of heart rates or responses to interventions during research can have serious consequences. We must verify information before passing it along and clarifying when things are unclear. Ethical communication involves humility, being willing to admit when you don't know something, and being quick to correct misinformation. Number 4, communicating with patients, families, and providers. In telemetry, we often deal with anxious patients and families. Effective communication means being clear, calm, compassionate, and honest, especially when explaining procedures or answering questions. Within our scope of practice, we provide reassurance and accurate updates and defer complex discussions to nurses or doctors. Listening is just as important as speaking. Formal communication, like progress notes, shift reports, or emails, should be professional, respectful, and fact-based. For example, if I notice a pattern in a patient's vitals that could be relevant to a study or care plan, I document it clearly and objectively. Avoid slang, emotional language, or personal opinions. Writing is another form of witness. Our integrity should be evident, even in our notes. In closing, ethical communication in healthcare is not just about rules. It's about respect, integrity, faith. Thank you for watching.